Joined by Dr. John Douglas, Executive Director of the Tri-County Health Department. Thanks for coming on.
Yeah, my pleasure to be with you.
How are you doing?
Uh, Surprisingly well, hanging in there. It's been quite a stretch here.
I imagine so. You'll hear people sometimes remark, "I didn't sign up for this." Um, you did sign up for this.
Yeah, I did, and in fact, my training is as an infectious disease physician, and so I've been dealing with infectious diseases my whole career, and this is the infectious disease of my career. So I guess I did really sign up from it since the beginning.
I want to ask you a couple of specific questions about Tri-County Health, but given your background, if you might answer a more general question for me and the folks who are going to watch this. Why does the advice from infectious disease experts keep changing?
Well, advice changes really, frankly, in any public health discipline or science discipline as the data changes and as we understand more about it. So let's take some examples of things that have changed. We've learned, for example, that the virus is not only sometimes transmitted, COVID-19, from asymptomatic people. We call that asymptomatic transmission. But in fact, that happens a lot. In fact, people are infectious for a couple of days before they get sick, and a surprisingly large fraction never get sick at all. So we didn't know that at the beginning. That was a big lesson. And so we've begun to reframe our guidance around who can transmit to other people. That was actually part of a reframing guidance around use of face coverings, masks. Originally, CDC and the Surgeon General said, hey, don't use these. They're not going to help you. By the way, we don't want to take them away from our first line providers, so don't wear them. And then we began to realize more and more about this asymptomatic transmission stuff, and we began to realize, let's not let the perfect be the enemy of the good. Cloth masks, non-N95, non-surgical masks, actually can reduce transmission from me to you, or even from you to me, to maybe 50, 60%. That's not perfect, but that's pretty good. And so that's the kind of thing that can help us. Some of the transmission models that people have been looking at, the president gets them. We've got a team at the School of Public Health developing them. Some of the models change because data changes. We have more information, we redo the model. So those are, we try to grow. I mean, that's sort of the mantra of science: learn and act and ask more questions and keep learning.
You mentioned the idea of masks. I had a conversation with Aurora Mayor Mike Kaufman, who was hoping for clearer guidance from Tri County Health on whether a mask mandate like Denver's is a good idea for Aurora. You guys decided not to do that and mentioned among the reasons for not issuing that guidance is that this has become such a political issue. What does politics have to do with public health?
Well, that was one of a number of things we talked to our Board of Health about. I'm not sure I would call it a reason. We listed that as a con for doing a public health order. Um, the governor's been saying over and over again, the sort of things we're doing now, social distancing or mask wearing, these are voluntary behaviors by people. And we'll get the most bang out of the effort that we put forward with a social distancing order or a face covering requiring order if we've got greater public cooperation. And when you begin to get people tired of staying at home, I get it. That's really been wearying on people. We've sort of felt like, let's be judicious when we use public health orders. We've just finished, we're actually still under one right now. Let's figure out when they're most needed and when they may not be quite as important. So we went around, sent our staff out to 50 stores around the Tri-County area last Thursday and Friday, including 10 in Aurora. It's not the universe. There's obviously far more than that in Aurora. And we were really surprised that when our staff sat there with clipboards and observed what was happening, 75% of patrons going into stores, I think it was 76% in Aurora, were wearing face coverings. Now, I've heard plenty of anecdotes of people, hey, I went in the store and nobody was wearing it and this kind of thing. And so this is not like, the most exhaustive sample, but we said, you know what, this is the largest sampling anybody's done in the metro area right now about face masking or face covering. Um, we're starting at a pretty good place. And frankly, the ability to enforce this, police are pretty busy. They're not going to be arresting people for non-mask wearing. Our staff's pretty busy right now, almost full time, trying to help businesses figure out how to reopen safely. So he said, you know what, 75%. We haven't really done much public education about masks. 6 weeks ago, 8 weeks ago, the Surgeon General said, don't wear them. And I'm still getting people saying, why are we wearing masks? And so we do have a big educational job to do that we think we have got some good ideas about undertaking. And so pretty high level, pretty tough to enforce. And we've got some other, I think, potentially even more useful ways of going about it. Let's give that a try first. Now, the mayor invited me to meet with him and the city council next week, and I'm happy to do that. And I've always said, and our board said today, look, if there's a context in which this may make more sense and we don't think we're getting compliance, this is absolutely something we should consider. So that was part of the equation.
So you've got the mayor of Aurora's frustration. Brighton City Council was pretty ticked at you guys meeting earlier this week. Douglas County used to be mad, then they got their way. Now Douglas County's not mad anymore. Is that just how it works, or are you disappointed at the way that this is played out?
Well, I'm an optimist. I guess I like to believe I can make most of the people happy most of the time. This has proven that that's somewhat of a challenge. Uh, we've tried to act on the best science we can. We've tried to act on the best public health rationale we can without being completely oblivious to the other things. I mean, for example, am fighting the COVID epidemic, and that's a primary priority. But if people lose jobs, if people lose health insurance, their health suffers. We've got, mental health hotline stuff going through the roof. We've got people afraid to go to hospitals or dying at home of heart attacks. Those are real health issues. So I'm trying to balance those health issues. And, as we veer one way and veer another, we won't always make everybody happy.
Do you have any fear of getting fired?
No, actually, not at all. My wife would be delighted. Uh, I think it'd be a bad time to fire somebody in the middle of a pandemic, but if the board under who I serve made that decision, I've got a lot of stuff to catch up on. So I would be disappointed. I would think it was frankly a mistake, but I would be, kind of goes with the territory. I do the best I can, and if that's the decision, then I've got lots of other things I'd like to be doing.
I think I know the answer to this question, but I still feel like I should ask it anyway. Are Adams and Arapahoe County ready to come out from under the stay-home order, May
Yeah,
8th?
yeah, I think we've made a lot of progress. I mean, the metrics of improvement get confusing because we're increasing testing, which is great. We haven't had enough testing. As we do more testing, we find more people infected. No surprise. We get more reported cases. So when we graph the cases, the line has a potential for going up. Now, right now, it's not going up, but it's not going down. It's kind of flat. So we're not as ready as I would like to be. But on the other hand, our hospitalizations, which are markers of serious illness, and frankly, probably less biasable markers by things like testing, those are going down. So that's a good sign. Because testing capacity is going up and because we're getting ready to be able to do better contact notification, I think we're in a pretty good spot, realizing that we don't have a vaccine. We'll be fighting COVID until we do. But we want to be cognizant of the economic, social, psychological, and health issues that are being created by the stay-at-home order. So I think we're in a pretty good sweet spot.
One last question for you. Thank you for being generous with your time. Do we have enough information and enough data that comes in quickly enough that we can avoid a situation where we yo-yo back and forth between looser and tighter restrictions where, oh, we see a 5-day spike in cases. Oh, what did we do 10 to 14 days ago? Go back to that, make another change, wait 10 to 14 days to figure out how it works. That just seems like a really frantic way to go back and forth.
It's a very frantic way to go back and forth. The best metric we would have would be number of new cases, but that's going to be artifactually impacted by the amount of testing. Hospitalizations are a lagging indicator. They're more reliable, but they take longer to look at. Frankly, one of the reasons that we wanted to delay a little bit in Adams and Arapahoe County was to avoid the early yo-yo. The worst thing we thought was to open back up and in 3 or 4 weeks go, oh my gosh, it was too early. Now, at any point along the way, we could get a second wave and it could be too early and we could have to go backwards and, discuss the idea of some things that have been opened back up, unopening or closing, if you will. And that'll be hard to do, but I think that's a possibility. The measures aren't as perfect as we'd like. The whole idea is let's do the tightrope as well as we can. That's one reason why I actually am a big fan, in spite of our discussions with Aurora about face masking. I think that's one of the pieces of insurance that we can be using that gives us a little more grace.
Dr. John Douglas, Executive Director of Tri County Health, I appreciate you taking some time. You're a busy guy. Best of luck in your work.
Thanks so much. Good to talk, Kyle. Be well.